Growing up in the United States, there are a lot of things that you might think are the same everywhere in the world, but when you start traveling internationally, you realize that that's not the case. In some cases, it's things that we take for granted, like our freedoms, clean water, and dishwashers. And in other cases, things that we were brought to believe are the best in the world actually aren't. And one of those things is undoubtedly the United States healthcare system. I remember the first time I realized that healthcare is different and often better in foreign countries. I was 20 years old studying abroad in Australia. I had to go to a clinic for something, and that's when I realized that healthcare is largely free for Australian citizens. I never forgot that, and as I traveled through more than 60 countries around the world, helping people move abroad as an international relocation consultant, this idea that healthcare is the best in the United States faded farther and farther from my memory. As it turns out, the United States ranks 69th globally when it comes to the quality of healthcare, and in one study, it actually ranked dead last among 11 high-income countries. So in this video, I want to share with you 10 countries in the world with outstanding healthcare, some of the best quality in the world, so that you have other options if you're thinking of traveling for medical tourism or even possibly moving abroad. Thanks to the incredible food, wine, and beautiful sights throughout the country, France is already one of the top destinations for expats and tourists alike. What you might not know, however, is that France's healthcare system is often ranked in the top 10 in the world by organizations such as the World Health Organization, EuroHealth, and the Bloomberg Healthiest Country Index. France's healthcare system is based on a universal coverage model with nearly free healthcare for almost all of its citizens. While the system has a lot of features in common with other European countries, such as the UK with its National Health Service, France stands out for having a single-payer structure. One of the benefits of moving to France is that as a foreigner, after you've been living there for at least 3 months in a temporary residence permit or temporary visa situation, you can actually qualify for France's national health care. Of course, when you first move there, you will need to have your own coverage, and there are a few different requirements for which types of policies will count, but after you've been living there for some time, even if you're not a citizen born and bred in France, you can actually opt into this system and really experience the high quality healthcare that France has to offer. Something unique about France's system, however, is that in some cases, you will need to pay for medical services upfront and then receive compensation and be reimbursed later. And so while this might sound scary, the costs for medical care are actually a lot lower than what you would see in the United States. One foreigner in France reported spending a few nights in the hospital after surgery for a broken leg, and the whole ordeal cost around 1,500 euro. Another said that their ER visit was 52 euro, 27 euro for a knee x-ray, 50 euro for a leg brace, and 100 euro for blood work. If you're just booking a regular doctor's appointment, this could cost from 25 to 50 euro, and a specialist consultation could go up to about 150 euro. As far as moving to France, the country offers a few different visa options, whether you're retired, you're a freelancer, working remotely, or even if you want to get a job in France. There's also a talent visa and a few other categories. So if you're curious about how you can move to France or really any country in the world, you can reach out to me at travelingwithkristin.com/relocation, or just scan this QR code right here. And make sure to check out this video's description for my video on the top 10 best places to live in France. If you've watched my videos before, you already know how much I love the Netherlands, especially cities like Amsterdam. But if you've ever been there for vacation, what you might not know is that this country is really a lot more than just canals, windmills, and bicycles. It actually has one of the best healthcare systems in the world. In the Netherlands, this is a country that's known for doing a lot of things differently, and healthcare is no exclusion. They have an interesting system that is part public and part private. So all residents of the Netherlands are actually required to buy into at least a basic healthcare policy that can cover things like doctor's visits and prescriptions, but also other things that we're not used to in the United States, such as home health services and also mental health counseling. There is a deductible, however, and patients may have to pay out of pocket for some services depending on your insurance plan. While this could sound a little bit like the system we have in the United States, it's really not, because the prices are much lower even if you're paying out of pocket, and the companies are also required to accept people with pre-existing conditions. Another huge difference between the United States and Europe is the Dutchies' kind of hands-off approach to medical care. It's definitely a more minimalist approach than you might be used to depending on where you're from, and they really focus a lot on preventative care and also encouraging natural healing, as well as responsibility for your own health. So this extends to even things like pregnancies and giving birth. The Netherlands has one of the lowest cesarean rates in Europe. It's about half the C-section rate of the United States. And whenever I'm in the Netherlands, my local and foreign expat friends alike like to joke about the healthcare system in a fun way. They basically say that no matter what happens to you in the Netherlands, the prescription is to take some paracetamol, which is an over-the-counter painkiller, and just basically wait it out. And that pretty much sums up my experience there as well. I have gotten hurt or gotten sick a couple times and went to the emergency room, and they pretty much just gave me paracetamol and sent me on my way. So that could take some getting used to, but if it appeals to you then, and the high quality of life in the Netherlands, then that could be a good place for you to check out. The Netherlands offers several visa options as well as a specific one for US citizens called the Dutch-American Friendship Treaty. And this could be for you if you are a freelancer, or if you work online, or you want to start a business in the Netherlands. Whether you're headed to a healthcare hotspot or just preparing for your next trip, you need the right gear. I just got back to Miami after a week-long trip visiting my family up north, and all I brought with me was my Nomad Lane bento bag. The bento bag is the ultimate travel companion that you can bring with you on the plane as either your carry-on or personal item. It opens like a suitcase, fits under most airplane seats, and has all the pockets you need for your travel essentials, including a padded laptop sleeve and external water bottle pocket. The bento bag also comes with a see-through toiletry pouch, a tech organizer, and a detachable crossbody shoulder strap. It's perfect for keeping you organized, whether you're visiting doctors abroad, booking a weekend getaway, or enjoying the sights in a new country. And it fits perfectly on top of your suitcase with a secure trolley sleeve. Get your Nomad Lane bento bag today and travel with confidence, knowing that everything you need is right by your side and very organized. You can save 10% on your bag now by using the link below this video, or click on this QR code right here. Enjoy your bag, enjoy your trip, and travel safe. Iceland is one of the most beautiful countries in the world, and even though it's become somewhat of a tourist hotspot in recent years, the population of the entire country is less than that of Tulsa, Oklahoma. Nevertheless, the Icelandic government has set up one of the best healthcare systems in the world. With a blend of state-funded care and patient contributions, Iceland's system provides universal coverage for all residents, expats included. Healthcare costs in Iceland are covered primarily by the state, with the vast majority through taxes and government, with only a small portion coming from service fees. One interesting feature of Iceland's system is that patient contributions are capped each month. So once you meet that limit, anything above it would be covered by the state. So this makes healthcare relatively affordable for the citizens there, but one of the major challenges that Iceland has with this system system is really just its small population. With very few people, there are also relatively few healthcare professionals. So in Iceland, you might experience longer waiting times, especially for specialized treatments. Remote areas in particular could have limited access, or you might have to travel to one of the major cities for treatment. If you're thinking about moving to Iceland long term, it's not the easiest country to move to, as depending on your residency category, you might have to pass an Icelandic language test. There are some options if you're working though. They have a work visa if you want to work there in person. There's also a digital nomad visa. Iceland was one of the first countries to launch that a few years ago, and although you do have to meet a high income threshold to be able to qualify, that'll give you 6 months to live there, and then you can also renew it. Stunning, mountainous Switzerland is one of the wealthiest and most expensive countries in the world. As you might expect from a nation with this kind of pedigree, the healthcare system was specifically designed to provide an excellent experience to all its citizens. And this strategy seems to have worked because the Swiss system often makes it to the top of global healthcare lists. Combining both public and private options, healthcare in Switzerland is highly decentralized, with differences between different states. To keep the coffers full, the system is financed through a mix of premiums, taxes, social insurance contributions, and out-of-pocket payments. In Switzerland, residents are required to purchase insurance through private, non-profit operators. So the premiums can be a bit higher compared to other countries in Europe, but these providers will still accept patients with pre-existing conditions, and you're also going to get high quality care and low wait times. You also get to choose your doctors and hospitals in most cases, and you can also buy a supplemental policy if you want even more options. Hospital visits, prescription drugs, physical therapy, and more are covered in the Swiss medical system, and you can also get private hospital rooms or more specialized treatments with that supplemental insurance. When it comes to moving to Switzerland, there is a work visa option for expats, but this is primarily if you already have a job offer in Switzerland. If you're 55 and older, you can also apply for a retirement visa there, and the requirements for this vary from state to state, but typically you will need to show at least $1 or $2 million in savings. Sweden is always floating around the top of these best places to live lists, and I can say from firsthand experience that they've definitely earned their spot on the list. From friendly people and hygge culture to underrated food and stunning nature, there's a lot to like about Sweden, other than the cold, dark winters, that is. Either way, it's no surprise that this country's healthcare system is top-notch. Sweden has a universal healthcare system that is funded by taxpayer dollars, but different to some countries, it's not just organized at the national level, but also down at the local level. In Sweden, most of your basic medical services would be covered as a resident there, but you might have to pay out of pocket for certain services and some prescriptions, and there's also the option to add a private healthcare plan as well. While the quality of care in Sweden is high, the system can be slow, with long waiting times, especially for non-urgent treatments and elective surgeries. This can get pretty frustrating for people who are used to more immediate access to healthcare, and navigating this system without knowing Swedish can also be a challenge. As far as moving to Sweden, the country offers a work visa, a self-employment visa, a digital nomad visa, and also a long-term residence permit that could be for retirees. While we're in the neighborhood, we might as well head over next door and take a look at Norway's award-winning healthcare system. Sharing the same peninsula as Sweden, Norway offers a lot of the same benefits. The healthcare system here is quite remarkable. Through a combination of general taxes and payroll contributions, Norway is able to offer universal coverage to all residents with minimal hassle. One of the things that really stuck out to me when I went to Norway, and I've been there a few times, is how peaceful the country is in general. But what surprised me when I went to go visit one of my friends in Oslo, who is a nurse at a local hospital there, was how peaceful and quiet and serene the hospital was. I know this shouldn't come as so much of a surprise because Norway is such a big country with a lot of nature and also a low population density, but it's really hard to explain the contrast between the feeling you get when you go into a hospital in the United States and the feeling you get when you walk into a hospital in Norway. It just felt so mellow, so relaxed, and maybe it wasn't like that all of the time, but my mom was a nurse in Florida. She's retired now, but I grew up since I was a baby going to visit her in hospitals in Florida. And let me tell you, it is a very different experience. So that's one of the things that stood out to me, and as well as Norway's general social safety net and other services that they offer, from required maternity and paternity leave to a lot of other benefits that you get as a resident or a citizen of Norway. But this does come at a cost, however, because Norway has some of the highest tax rates in Europe, although you do get what you pay for. Expat residents working in Norway are automatically enrolled in the public healthcare system and can access the same services as Norwegian citizens. But while the system is efficient and provides high quality care, non-emergency treatments and specialist services can also involve long waiting times. There are also limited private healthcare options as few people see the need for it. Keep in mind that if you are a non-European citizen moving to Norway, then like France, you will also have to have your own private healthcare coverage when you enter the country before opting in to the public system. Depending on how much you know about global healthcare, you might be surprised to learn that the rest of the places in this video aren't located in Europe, but a different region altogether. So try as we might in the West to have the best healthcare in the world, the next 4 places are all located in Asia. Let's start with Taiwan, a beautiful island country with a rich history and thriving economy. Taiwan's national health insurance, which is often simply referred to as the NHI, provides universal coverage to all residents, expats included. The NHI is mostly funded through payroll-based premiums and covers a wide range of services. The healthcare system here is definitely well known for its affordability and low out-of-pocket costs for residents. You're not going to believe some of the prices that I found for Taiwanese healthcare. It says here that most healthcare services have low co-payments ranging from 50 to 170 Taiwanese dollars. And when exchanged into US dollars, that's anywhere from $1.65 to less than $6. I also found that many co-payments at clinics, or if you need to get a prescription, can be free as long as the charge is less than 100 Taiwanese dollars, and that's equivalent of about $3.30 US. So these are some of the reasons that makes the Taiwanese healthcare system so attractive to local and foreign residents alike, but there are some downsides. So Taiwan's healthcare system can suffer from overcrowding, especially in public hospitals. And this is largely due to the affordability of the system that attracts such a large number of patients who are traveling there for treatment. Of course, language barriers can also represent an additional challenge for expats, although many urban hospitals have English-speaking staff. On the flip side, Taiwan is not known for being the easiest country to emigrate to. If you work in business, then the Taiwanese Gold Card could be a good option. There's also an investment visa, but that comes with a price tag of at least $200,000. Coming in third place, we have South Korea. Known as one of the most vibrant countries in Southeast Asia, South Korea has become a top destination for people looking for safe surroundings, fun nightlife, solid infrastructure, nature, and friendly people to boot. Like Taiwan, South Korea has a mandatory national insurance system, which is funded through insurance contributions and government subsidies. Also like Taiwan, South Korean healthcare is known for its rock bottom prices and premiums. So you get low cost, high quality healthcare in a country that is very developed and technologically advanced. What I found so interesting about South Korea's healthcare system is that traditional Korean medicine also plays a role alongside Western allopathic treatments. So this is a good place for you to go if you're interested in holistic and herbal remedies. But there are downsides. For starters, navigating this healthcare system can be challenging for foreigners due to the complexity of the bureaucracy and language barriers. While many hospitals have English-speaking staff, expats in more rural areas might struggle to communicate well with their healthcare providers. Something that's really important to keep in mind, regardless of where you go in the world for your healthcare, is that there are going to be some cultural differences in the way that you communicate with your doctor. So in countries like South Korea and also in the Netherlands and other places, you might find that the communication is a lot more direct and frank than you're used to in your home country. But not to worry, this is something that you can adjust to and really adapt to these cultural norms. And in South Korea, doctors are also very highly regarded in society. So either way, you're definitely going to be expected to speak with them politely and also treat them with respect. A downside to the healthcare system in South Korea is that there's still a bit of a stigma when it comes to treating mental health issues, although this is slowly changing. South Korea is another country with pretty strict immigration requirements. The teaching visa, E2, is available to Americans if you have a job offer to teach English, while the D10 visa allows job seekers to stay in South Korea while searching for work. If you're a retiree looking to go to South Korea, well, you might need to consider investing there in order to get the ball rolling towards residency or citizenship. Japan takes the cake for having the longest life expectancy in the world, 85 years, and for that reason, it's hardly surprising that this country has an exceptional healthcare system. Japan's system also provides universal coverage for more than 98% of the population. It's mainly funded by taxes and individual contributions and specifically focuses on hospital care, primary care, and mental health services. Expats are able to enroll in Japan's healthcare system, but keep in mind that some procedures you might have to pay out of pocket for, and this also goes for childbirth. But fortunately, the overall cost per year is quite low. The average is less than $3,000 per year per person, and for people under 75 years old, it can go down to less than $2,000 per year. Similarly to Taiwan and South Korea, expats might face challenges related to language barriers and cultural differences when it comes to communicating with doctors and medical staff. You can expect the same direct discussions about diagnoses, and like Korea, those living in more rural areas might need a translator in some cases. When I broke my hand snowboarding in Japan a few years ago, I found a mix of services. I got physical therapy from Australians. I went to a doctor who was Japanese in the center of Tokyo. And although he spoke a little bit of broken English, I found that most of the staff definitely had limited English as well. But that being said, everybody was so nice and friendly. If you've ever been to Japan, then you know how nice the people are and how incredible the customer service is. And it's no different in a medical scenario. The doctor was really patient with me, and he took a lot of time to explain the x-rays and all of the different treatment options, and the cost was pretty reasonable as well. I was also able to get that reimbursed by my travel insurance. So I'll link to the insurance company that I use in the description below. Japan is another country that can be difficult to immigrate to, owing largely to its highly nationalistic tendencies. However, the country offers several categories of working visas if you have a job offer, including teachers and engineers. Japan doesn't offer a retirement visa for foreigners just yet, but they did recently launch a digital nomad visa that you can qualify for with at least 10 million yen per year in income, or about 70,000 US dollars. The country boasting the #1 best healthcare in the world is the tiny Southeast Asian city-state of Singapore. With a population of just under 6 million and a very high rate of income per capita, Singapore is one of the wealthiest nations on Earth. As such, it offers subsidized public healthcare for residents, as well as a host of private options. MediShield Life, Singapore's public insurance system, covers large medical bills that come from hospital care or outpatient treatments, but residents also need to contribute to a compulsory medical savings account known as MediSave. This helps cover the cost of inpatient care and also select outpatient services. While expats living in Singapore have access to both private and public healthcare options, Singapore is known for having a high cost of living, and the medical services can also be a bit pricey as well. I have a list of some common treatments here, and it says that average hospital bills can range from $1,000 to $8,000, but specific procedures like a knee replacement can cost anywhere from $5,000 at the public hospital to $34,000 at a private hospital. So you have a few different tiers of service there. The average cost of their integrated shield plan there is about $4,300 if you are 45 years old, and it comes in at around $5,300 for a 75-year-old. Nevertheless, Singapore offers excellent care and low wait times, so it is worth it for a lot of people. The only thing is that because of the high attractiveness of this country, Singapore has tightened the borders in recent years. There are some work visas that you could qualify for if you have a job offer from a company in Singapore. There's also an investor visa that's pretty pricey, coming in around $6 million. But let me know if you're thinking of moving abroad for healthcare reasons or traveling for medical tourism. Comment below, subscribe if you're new, and watch this video next if you're looking for the best countries to go in the world for English speakers.